Hi, this is Dr. Centeno, and today we're going to talk about what is hip impingement and do you need surgery for a problem like that? One of the most common types of hip impingement that's routinely operated today is called a pincer deformity or a bone spur in a very specific spot. And basically, it's a bone spur on the socket of the hip joint. And the concept is that this bone spur is blocking movement, so we have to take it off surgically. Well, to understand whether or not that's a good idea, let's look at how that bone spur forms. So here we have normal forces coming up from the foot and ankle through the knee and into the hip. And notice that arrow ends up firmly in the hip joint. So the hip joint is designed to deal with that. But here we have someone that brings their knee in too far, off on the right, in this illustration over here, and you can see the forces end up way out here, outside the hip joint. Different from how they end up over here, they end up inside the hip joint. So if we zoom in on the normal hip, again, we'll see that those forces end up inside the hip joint where the hip is designed to deal with that kind of force, no problem. But if we go to the abnormal biomechanics where that person is not controlling their foot and ankle and their knee correctly, or there are other issues leading to changes in how the forces come up, we see a bone spur forming out here every time these forces are ending up in this direction out here. There isn't a joint out here, so your body builds a joint out here. You can see the bone spur forming as I speak. So the bone spur is forming to try to help the joint deal with these forces. So should we whack it out surgically? Again, the bone spur formed to try to protect the joint. So what's the rationale for surgically removing that bone spur? And in fact, that rationale was recently defined by a very well done big study. And what it found was that we probably shouldn't take that bone spur out. In fact, this very high quality research study showed that the bone spur that forms there protects the joint from getting more arthritis. Again, think about that for a second. The bone spur is protective of the joint. It's not hurting the joint. Hence, we don't want to take the bone spur out surgically. And on the other side of the coin, we don't have high quality research that shows that taking the bone spur out helps patients in the long run. So on the one hand, the bone spur is protecting the joint. On the other hand, we don't have high quality research that shows that taking the bone spur out will help the patient. So why are we removing this bone spur again? So what can you do if you have hip pain and this kind of pincer deformity bone spur? You need to find a physician who can treat the cause of the spur and identify the biomechanical issues that are going on, not just one to whack out the spur surgically to try a quick fix. Again, the cause of the spur is bad biomechanics in the hip, knee, ankle, and foot. So it's not usually a hip problem, even though your hip hurts. That's just a symptom of a bigger problem that has to be corrected. Thanks for watching. If you want more information about these concepts and the concept of actually trying to look at the orthopedic system in the body more holistically, rather than just surgical quick fixes, go to regenexx.com, REGENEXX, two X's at the end.com. Thanks for watching.